You know, joint pain isn't just a physical thing, is it? It can be a real financial headache too. So today, we're going to talk about how a powerful tool you might already have, your health savings account, or HSA, can help you pay for relief completely tax-free.
We've all been there, right? That nagging ache, that stiffness when you wake up, that little twinge when you get out of a chair. It's so easy to just ignore it. But what's actually going on in there? And, maybe more importantly, how can you afford to really take care of it?
So, first up, let's get to know the enemy. What's happening when your joints start to complain?
Okay, so according to MedlinePlus, joint disorders are basically conditions that damage the very spots where your bones meet. Think of it like the hinges on a door. When those hinges get rusty or bent out of shape, the whole door creaks and groans and doesn't work right. That damage, that's what causes all that pain, stiffness, and swelling we feel. And what causes this damage? Well, it could be a lot of things. We're not just talking about one single issue here. It could be a long-term thing like arthritis, or inflammation from bursitis and tendinitis, or, hey, maybe it was just a sudden injury, like a sprain. Figuring out exactly which one it is, well, that's step one to getting the right kind of help.
All right, now that we get the problem, let's talk about the solution. And I mean the financial solution.
Let's talk about what I like to call your dedicated health wallet. That's your health savings account, or HSA. It's a special kind of savings account just for medical expenses. But, and this is a big but, it comes with some seriously amazing financial perks.
The real power of an HSA comes from something called the triple tax advantage. It sounds complicated, but it's not. Here's how it works. 1, the money you put in, it's tax deductible, right off the top. 2, that money can grow over time, tax-free. And 3, the best part, when you spend it on qualified medical costs, you pay zero tax on it. It's like a financial hat trick.
But that third benefit, the tax-free spending, it all comes down to this one little phrase from the IRS, qualified medical expense. You got to know what this means, because this phrase is the gatekeeper for every single dollar you want to spend from your HSA.
So what in the world counts as a medical expense? Let's break down the IRS rules so you can use your HSA with total confidence.
Here it is, straight from the horse's mouth. The IRS says the expense must be primarily to alleviate or prevent an illness. That word primarily is everything. It means your purchase has to be directly aimed at a specific medical problem, not just for, general wellness or feeling good. That's the core rule.
Let me give you a perfect example. Let's say you buy a knee brace because your doctor actually diagnosed you with arthritis. That's treating a specific illness, so ding, 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 it's eligible. But now, what if you buy that exact same brace just for some extra support when you play basketball on the weekends? Well, that's just general wellness, so that's not eligible. It's all about the why behind the buy.
So what does this mean for your joint pain? Well, it means things you'd expect, like physical therapy, acupuncture, and chiropractic care are usually good to go. Even simple stuff, like over-the-counter pain relievers and medical braces, those are typically eligible because they directly treat a diagnosed condition.
All right, time to put it all together. We've talked about the problem, the tool, and the rules. Now, let's turn all of that into a real, actionable plan.
Think of this chart as your cheat sheet. It connects the dots from your symptom to the treatment to whether you can use your HSA. So diagnosed arthritis leading to a knee brace, that's a definite yes. Tendinitis, physical therapy sessions, also a yes. But look at this one, a general gym membership just for post-workout soreness. That's a no. Now, see that little asterisk? That's the exception. If your doctor prescribes that gym membership as a specific treatment, then suddenly it can become eligible. So if you only remember one thing from all this, let it be this. Your expense has to be connected to a diagnosed medical condition. It's not about feeling better in general. It's about treating a specific problem. If you get that one distinction, you've mastered your HSA.
And that brings us to the final question. You put in all this work to manage your health, right? So are you managing the cost of that health just as smartly? With a tool like an HSA in your corner, the answer can be a resounding yes.